Hi, Dr. Paul Kramer here, and what I want to explain to you is a little bit more about bones out of place in a direction your body can't self-correct. Now, when a bone goes out of place in a direction your body can't self-correct, and remember, between C7 and L5, that direction is forward. So when a bone goes forward, okay, it gets stuck, and it gets stuck because there's no muscle back here that could pull that straight back. But now your body doesn't like that position because now it's going forward. There's some pressure that occurs on these joints down here, and it also kind of tugs and irritates the nerves that are in this area. So it can't self-correct it, but in order to attempt to get some pressure off the joints and off the nerves, what it will do is it will take the muscles that are back here, these muscles that go up and down, and it will pull down on those. And what that'll do is that'll allow you to be more upright and take some of the pressure off. But now above that, you'll start to get muscle soreness because these muscles are pulling really hard, they get fatigued, and they get sore. So your body eventually doesn't really like that too much. So what it'll do is it will actually do things where it can pull another bone out of alignment. In this case, we pull C7 down and forward. And that will take some pressure off the mid-back, but then up above it here, you'll have another area that'll be more severe, and there'll be a lot of tension up here in the upper part of the neck. And this is a really, really common compensation pattern that I see with patients. They'll have a flat spot in the middle part of the back, and they'll have a misalignment up here at C7. They may come in with neck pain and headaches, but the problem originated from this area here, from this bone being forward or multiple bones being forward in this area. And so what I do is we go in and we correct C7, and that helps with the neck pain. And then we start working on the mid-back area, and that helps with that pain and gets rid of it, and your body eventually will pop up and you'll have the nice flowing curves that you're supposed to have here. Okay? Now, that's a very simplistic thing that happens with patients, but actually when you start getting into your 30s, 40s, and 50s, you tend to have some really complex stuff going on because by that time you have more and more injuries, more and more bones out of place in a way that your body can't correct, and all the compensating that it has to do in order to deal with those bones out of place. So here we have a model of a bone being out of place, and then the body doing something to compensate for that. And then you get another one out of place, and the body compensating for that. And you get another one, and another one, and another one, and another one, until the body starts to flop forward, and you start getting this that you see, and people start to get in older age where their head starts going forward to their shoulders. They start getting that dowager's hump that women typically get. They'll get that hump in the back of their neck there from having these bones out of place and the body compensating for so long. So what I do is we go in and we adjust the things that your body can't self-correct, and then your body will start to let go of those twists, and it will start to do a process we call unwinding, because when you watch it, as it goes along, it looks like you're taking a spring and fixing it. Like if you ever took a slinky and you mangled it up and then you tried to put it back in line again and get it to work right, it sort of looks like this. You have a twisted up slinky, and then as you're working on it, it unwinds and untwists until it finally goes back to normal. There's no way in one adjustment I can get from here to here. You do that gradually. You may do a little bit on one treatment, next treatment, the next treatment, the next treatment, and little bits at a time, your body will unwind through this until it finally straightens out. Each little time it doesn't look very different one to the next, but there's little differences, little differences, little differences. And when you go from here to here, there's quite a bit of difference in that. So that's what we're doing. And here it is with the ribs. You can kind of see what happens when you start misaligning, what happens to the shape of the rib cage and the shoulders and all that stuff, and how it gets all twisted up here. And then as we unwind, it straightens out. You can see how the effect of having these misalignments affects the distance here at the shoulder blades. Look at how this is crooked in here in between the shoulder blades, and the distance between this shoulder blade and the spine and that shoulder blade and the spine. And that explains why people get a lot of shoulder problems. It's because this isn't lined up correctly, and there's a lot of tension that's carried on the muscles here, and eventually that affects the shoulders. So as we straighten that stuff out, that goes away. All right. So we're going to talk more about unwinding and how that happens and what the effect is on your body in later videos.